without any further ado, I will call on Professor Ahuja to talk to us first.
Thank you very much for giving us this opportunity to share our work this morning. So as Talit mentioned, we'll be sharing some of the learning we've had over the last 18 months. And as researchers, I think it's a great opportunity that some of this work would be able to influence policy, because what we want to come out of this is hearing the voices of clinicians, professionals in social care, third sector, and how that can get us to work alongside policy makers and the government to make sure that we're not only protecting the environment, but also looking after our workforce. So just to say a bit about technology-enabled care, it's an all-Wales program funded by Welsh Government, working across health and care sector. I'm the National Clinical Lead for Technology-Enabled Care, and Gemma is the research lead. Both of us got seconded last year when Welsh Government started rolling out and implementing video consulting across Wales as a response to COVID. So very early on, when we think about March, we knew that COVID was coming along. We were going to go into lockdown, but it was making sure that we could continue to deliver safe and timely care to patients and the public of Wales. So we started off rolling out video consulting, offering video appointments with primary care, secondary care, and community care. The ethos of technology-enabled care, Cymru, is to offer a national platform, a single door, so that people can continue to get access to care using technology. So it's trying to deliver benefits for both patients and workforce. There are 3 work streams, but obviously with COVID, we were focusing on video consulting, but we also are now working on telehealth. So this is about remote exchange of data between patients at home and their clinicians. So things like pulse oximeter, blood pressure readings, blood glucose readings, so that we can look after the public and make sure that they can have safe care, especially in terms of the backlog we have, so that chronic illnesses who've not had chance to have appointments and see their doctors, their nurses and clinicians can have that support. And telecare is making sure that we can look after people and provide high quality life in their houses. So it's remote monitoring, alarms, sensors and alerts. So as I said, last year we, as a response to COVID, started rolling out video appointments nationally. As of this morning, we've done more than 260,000 video appointments between healthcare workers and patients. One thing both of us were mindful of was to evaluate from day one, because again, there's very little evidence of using technology in the healthcare. And what we wanted to show was that it not only worked for clinicians, but also for patients. And there was evidence that would support us, because we know coming out of COVID, the NHS is never going to be the same. So what have we learned and how can we embed that as we move forward? We'll be talking about the data that we've captured from more than 52,000 patients and clinicians. Throughout the 18 months, during our evaluation, we saw high rates of satisfaction, suitability, and acceptability across all services and patient types. So this was mental health, sexual health, nuclear medicine, speech and language therapy, physiotherapy, primary care, care homes. And sometimes it was even making connections between patients and their families. Another thing that came up, which probably was a myth that people held in terms of digital exclusion, people who are probably needing the most care from very socio-economically deprived areas with disabilities, the elderly, they would never be able to access this, because that is something that they are not able to afford or don't have the knowledge. And that data has been amazing, because it has dispelled a lot of myths in terms of what we have learned. We've noticed that there have been significant benefits, not only to the workforce and patients, but also in terms of the environment. So just to talk a bit about the digital inclusion that we've learned from what happened in the last 18 months. In terms of accessing video appointments, we found that there wasn't really a divide in terms of the rural and urban areas. As you can see, almost 31% of the population accessing video appointments was from rural area. And that compares very well with the figures that are from Wales, where 35% of our population lives in rural areas. Now, I know we take this with a pinch of salt, because last year there wasn't any other option other than having remote delivery of care. But this data has been taken over the 18 months. So when we started coming out of lockdown, and even now, as we have gone back to some sort of normality, the figures continue to reflect that 51% of our population were in the income group of less than 30,000, which again shows that, people have moved on. There has been a big shift in terms of people's mindset. We've noticed, most people now have access to some sort of a device, be it a mobile phone, an iPad, a tablet. Our grandparents, uncles, aunts are now learning. People have done Zoom quizzes, people have linked up with family thanks to technology. Again, in terms of male-female distribution, fits very well with the Welsh data that we have. And we did see that, in terms of access, I know there's a lot in literature in terms of males not accessing health as much as females, but maybe this was something that enabled that. Again, age range, consistently, we saw that 21% of people using video appointments were above 65 years of age. They needed support, but obviously once the support was there, they've continued to use it. So just thinking of, how we can provide care closer to home for some of those who may not find it easier to access transport to get to hospital appointments. Is this going to work for them? 29% had disability. And again, it can be very challenging for people with a disability, physical or mental, to often come to hospital appointments, which means that they do not attend and don't have access. And it's the inverse care law where people who need it the most often don't get it. 3.8% of our data reflects people from ethnic minority backgrounds. In terms of environmental benefits, this was just mind-blowing when we started getting the data come through. As I said, we've done around 250,000 video consulting, and the data that we have is from 50,000 patients and clinicians. So huge savings in terms of time, travel miles, carbon footprint. But I think one consistent theme again was the amount of time people spend finding a place to park when they come for hospital appointments. And we know that working in the hospital itself, sometimes you can, spend half an hour just looking for a parking spot. And I think that's one thing people didn't miss at all. When you think about the distance, it almost accounts to 72 trips from London to Auckland, although no one's going anywhere at the moment. But most of these figures are obviously based on the 50,000. So when you think about calculating it 5 times higher, considering we've done 250,000 appointments, the figures are going to be much, much bigger. The average saving was again 60 minutes per patient per NHS appointment, and similarly for clinician, but an added 40 minutes for parking. Huge savings in terms of, cost, but it's not just cost, it's the quality of life and the impact on the environment. So one benefit that came through right from the beginning was the ability to work from home. And I know that all of us, were forced to do remote working, and remote working last year was very different because obviously there was childcare responsibilities for some of us, homeschooling, being stuck in the house because people weren't allowed to go out. But as we come out, planning the future workforce, what have we learned? There are not only benefits in terms of saving travel and parking times, but also in terms of improved flexibility, allowing people that right work-life balance. A lot of people talking about an improved physical health and well-being sense, where people were allowed to have regular breaks, but also be able to adapt and use their time more wisely. And again, there were challenges because, there was a lot of social isolation. People were feeling lonely. Some of the new people starting in a team didn't feel integrated. Some musculoskeletal problems, which again, I think people didn't have the right sort of equipment. Some people didn't have space. A lot of family disruption. We've heard from families where they had to develop rotas in terms of who was using the desk and who was using the room, because everybody doesn't have that many rooms that are required for kids to do homeschooling and for, the carers to access work. So in March 2021, we advertised an all-Wales study to look at the pros and cons of working from home in detail, because that was something that was really pushed by the workforce. In terms of defining the ideal model, we worked with more than 500 people through virtual groups and surveys. And the thematic analysis that came out of this will be shared by Gemma. Over to you, Gemma.
Thank you, Alka. So I'm only going to be giving a brief overview of these findings, but I can share the link with you for the full report. So it's quite a long report. So there's lots and lots of lovely findings in there, but I'll just give a short overview. So as in working style, almost 56% of the respondents wanted long-term to have a blended approach, and 36% of these actually wanted to continue working remotely. And as you can see, only 8% wanted a full-time working from work to continue. So that was quite an interesting opening finding to sort of see that this new way of working actually was a wanted new way of working as well, but just with some blended. And then as you see the rest of the findings that I'll show you with some kind of amendments as well. The preference for working from home was pretty high. So it was 94.5% of all of our respondents stated that they would like to be working from home at least some of the time. So it was a very small percent that said they didn't, or that they don't work from home but would like to as well. But the majority were liking working from home, or at least sometimes working from home. So next slide, please. So as we sort of expected, because a lot of this data was coming out from our video consulting data, benefits of remote working were increased convenience, better clinical flexibility to be able to offer appointments at any point of the day, even if it be 7 o'clock in the night, less distractions in many ways. So even though there were distractions for some in family homes, there was less distractions from colleagues and people walking back and forth. And for many reported increased productivity, and massive findings came out around an improved work-life balance as well, with less time and money traveling as an obvious benefit. However, there were reports of certain dislikes that were associated to working from home. So feeling isolated did come out a lot, and there was a lot of feelings around missing professional support and that social contact. And also this then resulted in some feeling less motivated or less clear around the boundaries between their working and home life. And we have a huge amount of quotes and stories in the report, so you can go back and look at them. But this was pretty much a mixed bag. There was 50% pretty much saying negative based on relationships, but then we had 50% of our findings showing actually they had a positive impact on social contact, with lots of people saying actually working from home provided them with different social aspects, that they were able to see their personal friends more or their families more, or actually made more time because they were at home to do Teams meetings and making more effort. So it really was a mixed bag. And then a big one came out, which I think has changed slightly over time as discussions I've been having with teams, was relating to the lack of resources. So as I think COVID happened 18 months ago, we all went home within a matter of days, and there was not enough technology to hand around. But this did change. I think within the first 6 months, I was speaking with a lot of the teams, and they were saying, right, they've managed to get technology, they've managed to, even getting a webcam was impossible. I remember early days, but this did change, and it's slightly different with health boards and services. And for example, I remember therapies, they just couldn't get their hands on enough technology compared to mental health, for example, who were able to get technology. So it really was, again, this was a mixed bag, but I do think this was something that has got better over the last 18 months. Next slide, please. So the suitability of remote working. So the physical space, most, 87% of them stated that they did feel they had enough sufficient space in their homes to be able to conduct their clinical responsibilities. However, they did feel that some lacked the space, as obviously at the time when we all had our children home as well, doing doing all their education from home, there was a lot less space then. But again, I think with time and everyone starting to go back, that's starting to improve as well. And there was quite a lot of dialogue in there around adjustments that people made to their homes. So a lot of people turned their downstairs toilet into an office. A lot of people actually moved. A lot of people turned their garages into offices. So there was a lot of people realizing that this was the way forward. It wasn't just a COVID response. It really was something that people actually put an awful lot of time and money into actually making better space for their home working. So the access to resources, most actually felt that they did have a sufficient technology for working from home, in the sense that many people did go out and purchase their own laptops, their own equipment. However, obviously this was that at the personal cost, and that's not sustainable moving forward. Fulfilling their clinical and work responsibilities, most did feel they could fulfill these responsibilities, but some did state that that they worked more efficiently and effectively at home on top of doing this as well. However, there were some that did state also that they were struggling, and it's not necessarily specific to a certain role. Again, this was mixed. It wasn't specific to mental health clinicians, for example, struggling versus people doing physical health. It just was a mixed bag. I think it's down to personality at the end of the day. Next slide, please. So the impacts of remote working, one very interesting finding, which actually, so we did 21 focus groups. This was held with 138 clinical and non-clinical NHS workers. And one of the strongest themes that came out across all 21 focus groups was this feeling of guilt around taking breaks. It was something that just came out as a, oh yes, I feel that as well type of approach. And it was that every time they took a break, even if it being a 10-minute break to have a coffee, there was this feeling of guilt. They felt they needed to, you know, catch up and make sure that they caught up that 10 minutes later in the day as well. And that was shared a lot. But there was also then lots of dialogue around how to deal with this guilt, what measures they've taken, you know, discussions with their own teams, realizing that they all felt this way. And I do think, again, this was a short-term emotion that I think they were able to work through. Physical health impacts did come off. So over half of our respondents experienced some kind of negative physical impact. This included headaches and eye strain from looking at a screen all day, but also back pain associated to poor home setup. I think everyone had just pulled their kitchen chair to do a lot of work in those early days. I think the investment in new office chairs has probably been something of more recent. And then others reported, however, positive physical effects of working from home because they were able to exercise more and move around. So again, this was 50-50 mixed bag. Sleeping patterns and diet behaviour was similar as well. Some reported no impact on their sleep. Others reported much better sleep because they didn't have to get up and travel in the mornings. Diet, again, some people reported fantastic diet improvements in that they were cooking more, they were making more family meals, whereas others said because they were so close to the kitchen, they were constantly grazing throughout the day. So again, this was very mixed. Next slide, please. Commuting and travel, it wasn't a surprise. We had been capturing this, obviously, and we'd known that this was going to be a big saving. It was a saving personally to their own travel into their workplace, but a lot of those participants acknowledged how much this would be saving on individual health boards as well. And then the environmental benefits of this were acknowledged considerably. I think everyone knows, you know, and recognises the damage it does to the environment whilst we're travelling unnecessarily. So part of this study wasn't just to sort of capture the pros and cons, but it was to really understand if we wanted to inform policy, you know, the Welsh Government, for example, want 30% of their workforce now working from home. They had seen the benefits, they saw the environmental benefits, the cost benefits, and they put out a call about 9 months ago stating they wanted 30% of their workforce working from home. But what we were saying is that's great, but this needs to be an ideal working model designed by the people who are working from home, hence the reason we did this study. So this ideal model pretty much suggested that it was a blended approach, and moving forward with 83.5% of them wanting this, and it was pretty much described as the best of both worlds. And the importance of choice needed to be embedded into this. There was a strong desire for choice and flexibility, and that allowed individuals to design a working pattern that suited them. Next slide, please. So when we first did this study back early last spring, we condensed all the large sets of data down, and we came up originally with 15 recommendations. So this pretty much was recommending, you know, making sure that we're protecting the mental health and the physical health of our workforce, ensuring that loneliness and social isolation, you know, wasn't a damaging factor. We were looking around the aspects around guilt, making sure that professional development and fairness of promotions and opportunities weren't impacting on anybody's career, and a safer home setup, making sure that, you know, there was something out there, whether this be embedded into, new starter contracts or parts that actually you were able to maybe claim expenses on having to pay for, you know, a home setup. So what we did, we came up with, like I said, 15, but that was a lot as recommendations go. So we were also quite keen to send these recommendations back out into the public and do a peer review of the 15 recommendations. So 465 people took part in this peer review, and it went beyond the NHS. It went into social care, it went into universities, the Welsh government workers started taking part, HR, occupational health. It went quite wide. People were really keen to take part in the peer review, and the purpose for it was pretty much to help us redefine, define the recommendations down to a smaller number, but also to help us validate that we'd actually reached the right conclusions, because we'd heard lots of stories. So we came up with 7 in the end, 7 recommendations now that we're putting forward to the Welsh Government. And these are them pretty much in a short nutshell. So it is a blended approach moving forward, but moving forward as an option to all employers that want it. There shouldn't be some mandatory push to work from home. There needs to be a lot more fairness. But then again, this was a similar to all the findings being a 50-50 split. All these recommendations were a bit of a 50-50 split as well. Some people argued that it should be at the discretion of the health boards, the trusts, the managers, supported by also professional bodies, occupational health and employees, whereas a lot of people were arguing that this also needs to be based on individual employee circumstances as well, and the nature of their job role. So all of this needs to be taken into consideration when making the decision if people should be working from home and for how long. Again, the appropriate setup is absolutely essential, whether this goes under some kind of risk assessment or whether or not there's claims for expenses to be part of this, but making sure people are set up safely to protect, and then it's sustainable. We don't want anybody's physical or mental health being impacted for a change that may, obviously delivers good benefits to the environment, but we don't want that damaging our workforce. Next one, please. Improvement of IT infrastructure, huge problem in Wales. We knew this with video consulting. Obviously Wi-Fi needs to be improved as well moving forward. So this was a big call, but also other things like printing subscriptions and updated software and platforms are all calls that people wanted. One major thing in the NHS, obviously, is making sure that we are integrating our platforms and that people can access patient notes. Some services were able to do this, whereas some services were not. There are improvements being made, but obviously moving forward, for this to be sustainable, it needs to be streamlined. Recommendation 4 was making sure professional development was assessed regularly, but obviously depending on suiting to the roles as well, and making sure that everybody's responsibilities were clearly defined and the overburdened and feelings around guilt were often discussed as well. Next slide, please. Recommendation 5, interestingly, again, mixed bag. Lots of people wanted different things from working relationships. You will have some people saying that they miss their colleagues, but some people don't miss their colleagues. They don't want to talk to their colleagues. So we can't be pushing social events on people. So again, this is down to personality and their own preference. I think, social aspects should be put out there, but again, not mandatory. And then the mental health and well-being of the employees, and obviously making sure that the tackle around loneliness as well was acknowledged. So next slide, please. So we worked with a mental health team in Wales, and we worked with a spinal team, and we developed this infographic a while back. This was done in design and development of this study, but it's still valid and applicable. So we pretty much outlined the Welsh Government homeworking wants for 30%. We also acknowledged the fact that there's a tax release for homeworking. This was quite interestingly not known by many home workers, that you can claim back up to about £300 a year on your tax to contribute towards working from home. Like obviously, if you have to buy a computer, this doesn't help, but I suppose it helps towards things like additional electric or gas and that. And then there's a bit of an overview of how to protect your mental health and well-being, but also how to protect your spine, back, neck as well, and making sure you've got a safe home setup, and then just some helpful top hints and tips. So again, I can share this infographics on our website for you as well. Next slide, please. So just a bit of overview of our team, and a big thanks actually to all of our research assistants below who have helped us do this piece of work as well. They've been absolutely fantastic. And here's our website. So if anyone wants to look at the full working from home report and the infographic that I just showed, here's our website, or feel free to email one of us and we'll be happily forward them over to you. Thank you.
Gemma and Alka, thank you so much. Diolch yn fawr iawn. That was absolutely fascinating and, as I said, incredibly timely. I said at the start that we were going to be looking today and considering themes of isolation. Well, that was actually a really useful counterpoint to that, looking at how, in spite of the isolation over the past year, we've been able to forge new types of connection. And I think that that's going to be one of the running themes of the day, is isolation versus the collective, almost. If anyone has questions for Gemma or Professor Ahuja, then please do put them into the Q&A or the chat, well, into the Q&A if they're questions, and we'll make sure that they are responded to in the information pack that is sent to delegates after today's conference. We'll move